Good evening. I apologize for the late submission on this for everybody. It's been a crazy week. The first part of my presentation tonight is some background information on torts that comes from our WIN textbook on ethical principles of nursing. A tort is defined as an act of civil injustice that brings harm to another person. Harm can result from negligence or intentional behavior. If someone is intentionally harmed by a medical professional, this is called an intentional tort. Harm that comes from negligence is called a quasi-intentional tort. If a nurse has assumed care of a patient and then failed to take care of that patient, a breach of duty has occurred. If it can be proven that harm came to the patient and that harm would have been avoided if the nurse had upheld a standard of care, the nurse may face a civil tort case. Damages may be awarded to the patient for medical bills and/or emotional, mental, or physical damage. The nurse may also have to pay punitive damages, particularly if the harm was a result of an intentional action. In the scenario we're discussing here, there are two nurses whose actions we must examine. The first nurse, who gives the report and who was the last caring for the patient, seems to have committed a serious offense by restraining a man without orders. The second nurse, who assumes care, seems to realize this and approaches the patient, finding him wet and upset, unable to leave his bed. I consulted the written works of Prosser and Keaton and found the most serious possible tort here may be false imprisonment. Despite the report given by the offgoing nurse that the patient required restraint for his own safety, he appears to be completely oriented and has the capacity to communicate his needs, which have also been neglected. He has likely suffered emotional trauma and has the right to safe care and informed consent violated. Battery may have also occurred. The actions taken by the receiving nurse immediately after learning of this situation are critical for several reasons. The patient needs immediate assessment for circulation, respiration, skin breakdown, dehydration, and infection. Any wounds that occurred need to be documented and the provider notified for wound care orders. The nurse should contact the provider as soon as the patient is determined to be safe and should attempt to get another witness, preferably a supervisor, to assess the patient's immediate condition. It sounds as if the offgoing nurse indicated that this practice was normal in this patient's care. If this is the case, the supervisor would need to perform an audit of the patient's chart and interview the patient and staff that may have witnessed his restraint. Finding out that something like this has been going on in a facility is very serious. If any providers or supervisors have been involved or looked the other way, vicarious liability may apply. Additionally, if other patients may have been restrained in this way and harm may have come to them, the facility may even be at risk of losing federal funding. It is very important at this point that corrective action is taken, re-education occurs, and an investigation is conducted into this incident.